Hello, everyone. Welcome to our webinar. I'm Kristen Ayers. I'm the Director of Marketing for nVoq. Today we have 3 panelists as well as our moderator, Kay Cowling. But we'd like to start with a few housekeeping tips. First of all, if you would like to see more of the panelists and less of the slideshow, grab the horizontal bar and pull it down. We will also be taking questions at the end, and you can fill out your question in the question box or the chat box, and we'll be monitoring both and address those at the end. So let me introduce Kay Cowling. She is our moderator today, and Kay is a strategic advisor for nVoq, and we're really glad to have her on board. She also serves on the board of directors for Care Synergy, which is Colorado's largest end-of-life network, as well as CeLo Healthcare. She is an advisory with them, and is also a former CEO and president of several nursing and staffing agencies. Kay, thank you for moderating today.
Thank you, Kristen, and thanks to nVoq for inviting me to moderate today. I'm really excited about this panel, particularly because of the diverse perspectives of our 3 panelists. We have a CEO of a hospice organization. We've got a senior executive of an electronic health record company, one of the first to embed speech, I might add. And we also have a senior executive for a home health and senior continuum that's employee-owned with multiple locations. So I'm excited to hear what they have to say. I want to welcome you. And with that, I'm going to ask the panelists to please introduce yourselves, tell a little about your background and your current role. Tim, would you start us, please?
Yes, I will. Thank you, Kay, and hello, everyone. My name is Tim Meadows. I'm the CEO of Snowlane Hospice and Supportive Care. We're a nonprofit organization that started about 42 years ago and one of the original hospice providers in the region. Very well known for our compassionate, patient-centered care, and we're located in the beautiful Sierra foothills that serve communities locally and throughout the greater Sacramento area. I joined Snowline about 6 months ago after being administrator at Sutter Care at Home's Roseville Hospice for the prior 6 years, where we similarly also had a very good reputation for providing compassionate, patient-centered care. I'm proud of our success growing to the level where we cared for over 1,000 patients per year when I left. Before that, I held leadership positions with a large nonprofit provider where I led operations for its West Coast home health and hospice operations. Prior to that, with a mom and pop home health agency with a wonderful team that served the Albuquerque and Santa Fe, New Mexico areas. And prior to that, with a national for-profit healthcare provider with an exceptional therapy program in its San Diego service area. During my 15 years in home health and hospice, I've worked to bridge the gap to bring modern technology to home health and hospice with the goal of simplifying the work for both the frontline and the back office personnel who do the hard work. And nVoq is helping us accomplish that. Thank you.
Chris?
Thanks, Kay. So my name is Chris Puglisi. I'm the Senior Product Manager over Integration Interoperability for Matrix Care. I've been working with healthcare technology and EMRs for about a decade. And my focus now in my current role is to bring a level of technology to the post-acute space via an EMR that, in my general opinion, is lacking. It's been focused too much on acute and ambulatory at the expense of the post-acute providers. And so part of the big conversation today, of course, is why it's important that this technology comes down to post-acute providers, and nVoq is helping to support that.
Thank you, Chris. And Jamie?
I'm Jamie Brown. I'm the Vice President of Home Services with Eden Health, which operates 16 home health, hospice, and home care agencies in 5 different states. Eden Health is the home services division of Empress Healthcare, which operates around 60 skilled nursing and assisted living facilities. I've been with Empress for 14 years. And my love for home services comes from the joy that we see from our patients who are able to remain in their homes. I think I can go out on a limb and say that's where a majority of our senior population prefers to be as long as they're able. So I find true passion and purpose in being part of the healthcare team that allows that to happen.
Thank you so much. So now we're going to dive into our questions. We've got a number of questions for the team, and then we will also entertain Q&A at the end, as Kristen mentioned. So it's well documented the stress that the frontline workers have gone through over the last year, and even prior to the last year. In the last 2 days, I've seen 2 different articles, today from CNN, yesterday from New York Times, talking about nurse exhaustion. There's a new American Nursing Association article study that was put out in December of 2020, talking about 75% of nurses are exhausted. So it takes people, process, and technology to improve clinician satisfaction and engagement. And we're interested to know, and I'm sure our audience is, what are some of the things that our panelists are doing, your organizations are doing, to try to improve clinician satisfaction and retain this valuable talent to take care of seniors today? Tim, would you start?
Yep, yeah, great point, Kay. COVID has been and is still an enormous burden for our clinicians. During this pandemic, the hospice agencies where I've worked have cared for dozens of COVID positive patients, and we continue to work in facilities where known COVID cases exist. For nearly a year now, our frontline staff has been donning and doffing PPE several times a day before and after individual patient visits. This environment has dramatically complicated our frontline clinicians' ability to connect with and support our hospice patients, which of course is our primary purpose. My current agency here at Snowline is working to simplify and streamline processes for our clinicians as much as possible and within regulatory guidelines, of course, with the goal of enabling clinicians to focus on patients more easily by minimizing process disruption. And one of the most significant opportunities identified early in my tenure at Snowline is to simplify the electronic medical record documentation process. And that's with speech to text.
Thank you, Tim. Chris, you have a unique perspective. You know, you get to see lots of clients across the U.S. So give us a flavor of what you're seeing out there.
So, you know, there's a general consideration we approach this challenge with, and that is that there is a fundamental disconnect between the obligations a clinician has around documentation, meeting conditions of preservation requirements and other regulations, and what they're actually doing sitting in front of the patient. And you know, an overall challenge to be overcome is to unify those two realities, right? Because when you have scenarios where a nurse, for example, is going into a home and he or she, you know, wants to focus their attention on the patient, but that comes at a cost if they can't do documentation at the same time, or they don't feel they can because it's not efficient enough. They're taking that home with them, right? They're not going to sacrifice the engagement with a patient for tapping away on a laptop or a mobile device. So that is kind of a general challenge to all EMR providers. How do we put a point of care device in folks' hands that they feel they can sit with the patient, go through their assessment, still engage the patient without being hindered by technology? And when you come down to it, you get into areas like narrative, because an EMR can streamline with you know, smart logic to jump you to the right questions you need to fulfill for you know, whatever requirements you're trying to meet. But when at the end of the day, there's a certain amount of human intelligence that has to go into assessments, and that's where a lot of the burnout can come from. So no matter how streamlined an EMR can be with that point of care documentation for the required stuff, the narrative, the real insight, the human intelligence into what a patient's condition actually is, that has to be typed out. And you know, technologies that can be brought to bear there, I alluded to in my intro, they've existed for over a decade in a lot of other settings. So when we're talking about kind of addressing some of these key burdens that'll, you know, lighten the load on nurses, it's allowing them to focus on care while getting the documentation done and feel efficient in doing so accurately and thoroughly. And so speech to text is a component of that. There's lots of other pieces, but speech to text is such a big one because it's right there sitting. You can't sit and type out, you know, 30 paragraphs while you're sitting with a patient. No one wants to, and I don't know, I would feel kind of uncomfortable not having done it myself, but sitting for 30 minutes in silence as I tap on an iPad. So bringing technology in for this scenario and others is the way to solve in our view. And its question is the right technology. And we feel speech to text certainly is the right technology to begin going about this large challenge for both EMRs and for the providers using them.
Thank you. That was a great overview. And Jamie, gosh, you've got how many offices across how many states that you're trying to figure out, retention here?
17, yeah. Just to piggyback off of what Chris was saying about the documentation component, my job is to lead the division, but also I see it as being an advocate for our frontline workers so that we can adopt changes as an organization that will make their lives easier so that they can focus on patient care rather than worrying about how they're going to spend hours every night documenting what they just did that day. Anything that we can do to help our clinicians in the field be more productive and less worried about a cumbersome documentation system, the better. I also strongly believe that clinicians get into this industry, home health and hospice, because they really want that one-on-one patient care that they can't really get in the inpatient setting, the hustle and bustle of the hospital or the SNF. And unfortunately, we're regulated to have all of this paperwork, but anything that we can do to eliminate that tablet or computer being a barrier between the clinician and his or her patient, the better. And that's what we're always focused on with our company.
That's great. Are there any other examples of anything that you're doing in addition to speech recognition for our audience on clinical satisfaction, or that you'd like to share, Jamie or Tim, before we move on?
It's definitely a broad initiative to simplify things. I mean, we're upgrading our human resources information system and going from a paper-based to an online system. So that would be another quick example that I could share.
Okay, thank you. We'll move on to our next question. So Chris kind of answered this a little bit, which I really appreciate. But the question is for probably Tim and Jamie, and Chris, certainly if you think of something to add, how do you see speech recognition fitting into the macro plan to retain your talent and improve clinician satisfaction? You talked about this just a little bit, but do you have anything you'd like to add?
Yeah, I sure do. Both Chris and Jamie have alluded to the challenges out there in the field when our staff are with patients. And I understand the home health and hospice space is one of the most regulated industries in the country, behind the nuclear industry. So that kind of gives people that maybe don't work in the industry a sense of the onerous documentation requirements that we must endure. And therefore, there's kind of a drudgery factor, from my opinion, with hospice and home health processes due to the high volume of patient visits that we complete every day. And this is most agencies across the country. Speech to text or speech recognition technology is already widely available. Look at your smartphone. We can easily speech to text to send a message to family or friends. But that's not so easy in this world, because that application on my Android device is not HIPAA compliant. Thankfully, nVoq has created a HIPAA compliant solution and brought it to both home health and hospice. So recently, and I'm talking about during the pandemic, Snowline ran a pilot to test nVoq's claim that speech recognition can help save time. And soon after the pilot began, we received several positive comments from people with a variety of different roles within our organization. And they are expressing a lot of positivity, which really made it an easy decision for me, for my team, my leadership team, to go ahead and partner up with nVoq, purchase enough licenses to roll it out to our entire team. And we're in the process of doing that right now.
Thank you. Mm-hmm. Chris, you gave us a great overview before. Do you have anything to add to this question?
Well, I think it's the efficiency, like I guess I did reference, the efficiency that you're gaining from this technology is the easiest measurable thing, but there's a whole bunch of other components that this falls under. I know there's general understanding that not only do you talk faster than you can type, but you tend to be more thorough, right? You're going to say more specific things because you're not trying to fit in some sort of shorthand. So again, speech to text fits into all sorts of different solutions to broad problems. Just about application and making sure that it's part of a process both within an EMR as well as within an organization.
Yeah, and I would think there's some quality issues there. You talked about you can speak faster than you can type. It's interesting to think about accuracy and things like that too. Jamie?
So for us, we conducted employee surveys as part of our Great Place to Work certification that we just got for 2021, second year in a row.
Congratulations.
Thank you. We're extremely excited to have that certification, but I always say that it's great to have it, but what's even better is being able to get real feedback from our employee owners and put action plans together to implement things that we can change. And one of the recurring topics from that survey was that documenting in our EHR is complicated, it takes a lot of time, and our owners were asking for management to help pare it down. And as we all know, as Tim said, home health and hospice documentation is very robust, especially if we're talking about admissions. And over just this last year, we've seen this huge surge in referrals to home health versus those inpatient settings for various reasons. So from a strategic approach, it only made sense for us to implement technology that allows our clinicians to be more productive in the field, which is where nVoq comes in.
Great, thank you. So now we're curious about the decision-making process. I think, healthcare, you mentioned the regulatory piece, right, Tim, a little bit ago, and it is tough. It's tough to make these kinds of decisions for a lot of reasons we're going to cover even further in our questions going forward. But maybe you could share with us what was your decision-making process?
No, absolutely.
It's a big deal. It's a change of process.
It is very significant, and some organizations are almost hardwired to prevent innovations like this. So it does take some perseverance. But my organization selected nVoq speech to text for our remote clinicians to use during electronic medical record entry. I listed 4 things here. Number one, the value it delivers as a HIPAA compliant app. That's not possible with other standard apps out there, as I mentioned a moment ago. Time savings realized during medical record documentation. It also, with less typing, reduces hand and arm strain. That absolutely is a problem for some people. So that's a way to minimize the stress that people endure from hours and hours of typing per week. And as has been alluded to, it also helps enhance the overall clinical note quality. For example, you'll probably see fewer acronyms, more complete descriptions, and as Chris had said, more complete descriptions. And then we found nVoq to be, quite easy to work with. They're a very effective partner. For example, during our pilot, nVoq applied some of the user comments towards software enhancements that improved the performance of the app. So it's nice to see that. Speech recognition was a quick win, I think, for any healthcare organization that's not currently using it. Also, if you're a small nonprofit operation like mine, without an extensive IT and education department, that's okay because the application is easy to install on your clinicians' devices, and you can quickly train your staff how to use it, and before you know it, they'll be putting it to use, completing their documentation, and that's the win.
Great. Hey, Chris, here you are, a widely known and growing electronic health record. You had to have done a lot of due diligence. Tell us a little bit about that due diligence and the key considerations that your organization took into account before deciding to partner with nVoq.
Sure. So fundamentally, Matrix Care as an organization, and specifically in the work that I do, are focused on uplifting post-acute care from a technology standpoint, which I mentioned before is largely something that comes like a decade later for post-acute. And we see this up and down. It's when it comes to interoperability and connectivity with other EMRs and health systems and so on. It's something that a lot of post-acute providers struggle with, and it's not easily accessible. And speech to text, it's been around 12 years, 15 years, something like that. In radiology, especially, but other acute and ambulatory spaces, it's commonplace. It's expected to a certain degree. And when we look at what technologies really do belong with clinicians in post-acute, speech to text was kind of a no-brainer. And the reason for that, again, there's a proven scenario where narrative documentation is being made more efficient and people prefer to use it in a space that has similar documentation requirements. We're just talking about like a block of text being generated. The difference is, of course, that there's certainly challenges from what the current speech to text industry expects for what they can charge in the marketplace. There's also, broadly, just not as much of experience in post-acute with this kind of technology, and so bringing it there is it's a step. It's a step that everyone has to adjust to, and Tim mentioned it as well. It's a risk, but it's well worthwhile if you get everyone to buy in. So when we started looking around, we had a couple key considerations. First, had to be HIPAA compliant. We have people out there trying to use Siri and Google Assistant and whatever else. Many problems with that, but at very least from a functional standpoint, you don't have a medical dictionary, so it's never going to pick up most of your words. Then we were looking for organizations that had a similar view of connectivity as us. Newer technology that's designed for efficiency and expansion. And then lastly, and I mentioned before again around what the current industry landscape looks like when it comes to speech to text, but no one's going to be able to spend $100 per clinician to turn it on for one of these other vendors. And so when we look at the kind of ways, where we ended up with nVoq is, well, this is a vendor that has the technology we're looking for, that kind of views the landscape the same way we do, from both a price standpoint and a culture standpoint. It became a logical step to move forward with them. And since then, what we've seen is like the technology worked exactly as expected in terms of how we were able to almost seamlessly embed it into our product. If it wasn't for the fact that we call it that it's nVoq in different areas, you wouldn't actually know that nVoq is involved at all. It's a microphone that allows people to record text. So that's been my experience, and one of the reasons we focused on nVoq again is their focus on this part of the industry, which deserves the attention.
Sure does. Thank you, Chris. Jamie, how did you go about the decision-making process?
So we use tablets and phones in the field, and for obvious reasons, as it's already been mentioned, we had to turn off the speech option that comes with those devices because it's not HIPAA compliant. And we've gotten a ton of requests from the field for us to turn it back on because it'll cut down their time on typing in information. So we went on the hunt for something that was HIPAA compliant and also was able to easily integrate with our EHR, because that's important, not to have people using two different platforms to document their visits. I'm sure we've all had some crazy things come out of what we were trying to say in a talk to text type situation. So I'll be honest, I was very leery when we were on the hunt for this. We definitely don't want to go rogue with our documentation, especially with surveyors reviewing and if we get an ADR or something. But when our management team sat down together and watched the demo for nVoq, I think we all had to pick our mouths up off the floor, because it was just so incredible how fast you could talk and then how accurate it would type out every single thing that was said. And we were sold right then and there. And then to go back to having this available for our industry, which is already readily available in hospital settings, when we have medical directors who work with us on a hospice perspective and then wonder, why do I have to sit down and type out hours worth of documentation for our hospice patients? just having that available for them when they come and work with us just also helps bridge that gap.
Great, thank you. It's very helpful. So next we're going to talk about change management a little bit, the key adoption and maybe 6 key success factors. You know, when I was talking in preparation for this to Tim the other day, he said, you know, one of the things that's the most difficult in adopting a new technology is the change management piece and getting people on board. So we want to hear from our panelists a little about some of the key success factors in early adoption and change management. And what would you recommend for our audience who's considering to do this? Tim?
So I alluded to this in my prior comments, but it really took me another organization before I was able to really deploy nVoq. As I had mentioned, sometimes organizations aren't very open to adopting the technology for a variety of reasons. So it was at Snowline where I had the authority to really authorize this. So I'm not telling people out there that leave your employer and go to someone smaller, but in my case, that's kind of what it took. All that said, you need to define your goals. What is it that you as an organization are looking to accomplish? You know, certainly I think the theme here is to simplify things for the front line and perhaps cut down on the time, which leads to labor cost savings. So what is it that you need to accomplish, number one? And then I absolutely recommend a test, a pilot with a small group of users, and hopefully from a variety of different specialties within your organization. And that's to determine whether or not speech recognition helps your team meet the goals that you've established up front. And if it does, you will realize you're gaining user advocates as a result of the pilot. And they talk to their peers and colleagues, and before you know it, those people are saying, well, when do we get to try it? So you have your own internal lobby and advocacy groups. And if it's a positive experience, go for it. Roll it out to the rest of your team, and I am very confident they'll thank you for it.
That's very helpful. And Chris, how have you seen adoption? I know it's embedded in your software, but maybe you can share a little bit about what the experience has been thus far.
Well, so the experience from our end is actually similar to what Tim described as like a best practice. So most of our organizations, both in terms of the pilot that we launched last year, as well as organizations that have since contracted for the services, you start with a small number of, we'll call them power users, that become the evangelists and the advocates. And from there, based on everyone's comfort level, it expands. And however fast or slow that expansion goes, of course, depends on the agency's comfort level. But ultimately, you know, the kind of slow goes it. Make sure everyone's on the same page. Make sure everyone has a way that this problem that you're trying to address is being solved with the technology, and move forward that way. It's an you know, a surefire way to win with new technology. And I'll add, we see the same kind of scenario with every, you know, new technology or new integration or innovation that we roll out on our end. Is you get those number of evangelists out there, and the rest of the organization usually buys in.
Thank you. Jamie, change management across 17 locations in 5 or 6 states.
Yeah, tough one. I agree with everything that Tim and Chris said. It's not new to any of us. We all know that people don't embrace change right away. In our profession, we have a ton of change thrown at us, sometimes on a daily basis, especially having gone through what we just went through last year with this pandemic, and regulations and guidance from the CDC changing on sometimes what felt like a daily basis, maybe twice a day sometimes. And as managers, you know, we obviously feel the effects of that change, but imagine being a field clinician in home health or hospice, out there all by themselves. There isn't a hallway that they can go walk down to ask questions from their coworkers or managers. They're really out there by themselves. So the way that they feel change is much more intensified than us in administration. And so it's really hard to get folks to embrace change when it has to happen. And I think we all have to be very sensitive to that. I think it's really important to have someone who can champion change, kind of going back to what Chris said. That's the main go-to person for whatever change is happening, so that everybody knows who to call when they have questions, or if they're not understanding, or if they need more training. And that person is also in charge of getting people excited and explaining the why we're doing this and how it's going to benefit them at the end of the day. Because if people don't understand the why behind it, it's so hard to get them to adopt and embrace that change.
You are absolutely right. You know, people want to know why they're having to do something different than what they're used to. It's really important. I liked your point also about having a key point person who really is the driver of that initiative internally.
That's been really, really successful for us, you know, with so many different locations. Knowing who they can go to at all times is super critical, just because there could be so many people involved in a project, but who do I go to for what kind of thing? And if we can really define that up front and communicate and communicate and communicate about what we're doing, it makes things a lot more successful across 5 states, 16 locations.
Yeah. No, that's great. The key to change management: communicate, 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 right? All right, super. So now we want to know, what's the experience been so far? Give us some feedback. So what have the challenges been? What's some of the feedback? And are there any surprises?
Yeah.
Tim?
Certainly one of the challenges was people who say, I'm a fast typist. I don't need this. You know, once you roll out nVoq, people can still type. And I wanted to bring this up because once the restrictions of social distancing lightens up and people start returning to coffee shops to take a little break and oftentimes do a little bit of documentation, you know, you wouldn't want to be talking to your computer and doing medical record documentation verbally in that kind of a setting. So you're still able to type. So just wanted to make sure everybody understands that. But some of the comments we received, the number one comment by far and away was it saved time. It increased the speed of my documentation, meaning I didn't have to document as long. So by far and away, that was the number one comment. But I have 3 others I'd like to share. One was it improved my ability to communicate in medical terminology, and I'm using less acronyms in my charting. The next comment that we received was it allows me to leave one hand on my mouse and not have to find hand placement on the keyboard as they go kind of back and forth. So they found that to be an efficiency thing and a job satisfier improver. And the last one, and this is from a nurse, you might be able to tell, multitasking. I can talk and dictate while I'm doing another task with my hands. So those were some of the comments I wanted to share today.
Oh, those are great. Did you have any surprises?
Well, I think the surprises were the people that thought that they could type faster than they talk, and they found out that's not true. You actually talk faster than you type. So that was a good one.
Thanks, Tim. Chris, any feedback from your client base or challenges?
Sorry, I muted myself. So the biggest initial feedback for the early adopters, the power users that I mentioned, was kind of exactly what we had been expecting, which was, well, this is everything's more efficient. I'm getting more done in the home in some cases where they felt comfortable. I'm spending less time on these long narrative sections. As far as what surprised us, there was just a general appetite to, you know, adopt the functionality in more specific ways for different workflows. And so it wasn't just, hey, this is great. You know, you've done everything we're hoping for. This is great. And you know what else would be great? You do X, Y, Z other things, which we're really excited about, because as soon as folks start looking at the technology as an opportunity, we have a good way of you know, finding out the right scenario to support. So what was more expecting a generic, hey, this is great, and got a, this is great, let's do more, let's evolve.
Great. Jamie, challenges, feedback, surprises?
The feedback is pretty much the same as Tim and Chris were mentioning. Some clinicians said that They weren't looking forward to using something new again, you know, again, another change management discussion, but as soon as they did, they're hooked and they're never going back to typing. So super big win there. Other feedback has been that they spend on average around 30 minutes or less for each admission, which is huge because we know how much work admissions are in home health and hospice. And then the other unexpected thing that came out of this, which is great, is when our clinicians are using nVoq for dictating their visits, the patients and caregivers in the home can hear everything that they're saying about their visit, their care plan, and what their plan is for the next visit. So it's really helped in communication between clinician and patient. And if they hear something that they're not familiar with, they can ask questions at that point. So it's been great from that perspective. It also allows for that real-time documentation that we were talking about earlier versus taking it home and spending hours in the evening. And I truly believe that, you know, documentation at the bedside, quote unquote, will really help us from a regulatory and audit perspective as well.
Yeah, regulatory audit, but even more importantly, that patient experience. That's wonderful to hear. That's great. Well, you all have given us some great points and some good information, I hope, for the audience too. And now we want to open it up for Q&A. And Kristen, I know you've been monitoring the chat.
I have been, and we do have a couple questions from the audience. The first one is, we have heard from hospice agencies that they're looking for ways to reduce write-offs and have identified the narrative component of the note to be of most importance. So this is probably for Tim and Jamie. What has your experience been with the write-offs and reducing the write-offs using speech to text?
Would you like to take that, Jamie?
Is that a stumper? Did we start with a hard one?
You know, the main reason that I'm deferring is we're just so new in the deployment. I don't really have any specific examples I can share, even though I'm sure they'll come. But that's why I'm kind of punting.
We're very new in our deployment as well. We're about 4 weeks in. But what I will say is that we know in hospice that medical director documentation, especially during IDG, is super critical and can really hurt you in ADRs. And so giving our medical directors a tool that they can use that allows them to be more verbose sometimes where it's necessary is for sure going to help that. I don't have any specific examples of that in our organization yet, but I'm really looking forward to sharing that later.
Well,
yeah, that's kind of a laggard, isn't it? You know, unfortunately, the cycle on billing and errors is not fast. You wish it was, but it's not in this industry.
We'll definitely come to part 2 of the webinar and address that.
You know, the one thing I'll add, though, kind of to dovetail with what Jamie was just saying, was our medical director was one of our testers, and she absolutely out of the gate was a huge advocate and fan of this. Absolutely, the other medical directors who've used it, the other physicians, I should say, use it for their narratives, and one of them even said it was a game changer. So just in terms of their adoption, you know, go advocate, definitely give them the chance to use it. And I think a lot of you will find that they love it.
So another question we're getting, and hopefully it's not too soon to answer this one, have you attached operational or quality goals to the use of speech recognition?
So yes, I have to say it's informal, but the bottom line is, you know, you need complete and accurate documentation for every single patient, and by simplifying the process, it's easier to get there. When people are charting at night, they're working overtime, they're behind. In my experience, that's when the gaps occur, and that's one of the big motivators for me as the CEO of this organization is to set up the team for success, which means that they're going to help the organization be successful in its outcomes and its initiatives with compliance.
Jamie, have you been able to set any goals yet?
So we've, with adopting this technology and allowing a little bit more time for our clinicians, our biggest goal right now is to get as much documentation completed in the home as possible. As Tim said, if they're taking that home after a very long day, especially after everything that they're going through right now with all that extra PPE and everything that's taking time, they're going to forget some of the stuff that they were doing in the home. So the more that we can get them to document at the bedside, as I mentioned, it's just going to help us hugely with quality.
And just from our end, that's one of the metrics that we're aiming to track as we continue to expand this implementation, is how administrative time and non-billable time is being reduced over time, over the course of the expansion.
Excellent. Great, thank you.
So another question that has come in, and this is a little bit more of an essay question, so sorry about that. The audience member said, I hadn't thought about speech to text as a solution to some of our basic challenges that are being outlined, and I'm finding this discussion enlightening. Can you share more on the unexpected benefits you're seeing?
I guess the one that, I don't know, it seems so obvious, but the person that said it relieves the stress on their arms and on their hands. I mean, that seemed obvious, but I wasn't thinking about it. And what a great surprise that was. Ergonomics are essential, and especially those of us that work in offices. Oftentimes, our chairs, our monitor, everything's at the exact correct height. That's not the way it works out in the field. Oftentimes, they're documenting where they can. They're sitting in a corner, with their laptop or their tablet, and literally in their hand in their lap. It's not an ergonomic setting. So whatever we can do to kind of ease that strain, that's been a surprise for me and a pleasant one. So, by extension, I think we're going to see fewer work-related injuries, repetitive stress type things occurring over time. So I think that's a huge advantage that I wasn't expecting, that I probably should have, but, just being real, that was our experience.
That's cool.
That is good.
I think just to actually add to that, but I mean, broadly, the efficiency factor is the easiest to measure, right? That's where what people think about when they think about speech to text, but it's the other kind of more intangible things that are important and will continue to be important. And we've alluded to most of them today, but more accurate or more expansive documentation, more better engagement with the patient, and overall reduction in stress. So those three things those are harder to measure. But they're probably the more important things that you don't necessarily jump out at you when you think of this technology that you're more familiar with in a consumer context.
Jamie?
Yeah, I think for us, that patient engagement factor was something that we weren't expecting, but it is such a beautiful thing to have come out of this, because it helps us in so many ways, with compliance and everything else that we have to do when we're in the home. And just like Chris said, summed it up perfectly. I think it's all of those things are huge.
It's interesting. And it's interesting to think about as we move towards a value-based care to some degree, right? That patient satisfaction, as we think about what's that going to mean to have a value-based care situation in our future. It really kind of supports that, doesn't it?
Yeah, absolutely. We're in 2 value-based purchasing states, Washington and Arizona, and that patient satisfaction component, teaching the caregivers in the home, all of that plays into it, which also ties into reimbursement. And we're always tasked with how to do more with less. So, using this kind of technology is really how we get there.
Thank you.
So we do have another question, and obviously with Chris on the panel, we know that nVoq speech to text works with Matrix Care. Jamie and Tim, would you be willing to share which EHR you work with and how's the experience been with your particular EHR? Sure.
Yeah, we use NetSmart here, and it's been rather seamless. We do have a systems administrator who installed the application on each person's laptop computer. but it's been rather seamless. We didn't initially begin with headphones and microphones, but they did suggest we do a USB headphone mic, so we plugged that in, and that helps with accuracy. But literally, that was all it took. Was once the nVoq application is installed, and obviously in Chris's case, it's even easier with Matrix because it's installed for you. You click the mic and you start talking, and the fact that it is tuned to the medical world is huge. I didn't really allude to that, but that's one reason for sure that we selected nVoq is nVoq understands our language.
Jamie?
We use home care home base, and it was pretty seamless. There were a little bumps with just our IT department, but that was an internal thing more so than it was our EHR or nVoq as an application. And yeah, very seamless. It's literally just click of a button and then they can talk into it. And there is no going outside to another application. It just automatically integrates into their narrative.
Great. So we have a follow-up question to that. Another audience member is currently an HCHB Point Care customer, and they're using Android tablets. Can you share more on the clinician experience getting started with nVoq?
Yeah, we use Android tablets for our clinicians as well. At first, we were using wireless keyboards so that people could document their narrative easier because, using a tablet to type in so much information is pretty tough and cumbersome. And then now we've been able to eliminate the use of those keyboards for people who are adopting this technology, and they are clicking through their visits, and they're really, really, really happy about it. I haven't heard one negative thing about nVoq from any of our field staff.
Well,
Have they increased the number of visits, or is that not something you're even requesting?
We haven't requested to increase visits, but we have had some feedback from clinicians who have said, I could probably take on another visit today if that's needed. So, all the benefit to them and to us as a company and ultimately our patients.
excellent.
Kristen?
There are no more questions, so we'll give it just another second in case anybody has anything last minute. But otherwise, I think, Kay, that you can wrap it up.
Well, I want to thank Tim and Chris and Jamie, and you too, Kristen, for your parts in today's webinar. I hope that the audience has gained some valuable tips and maybe increased their knowledge and understanding of speech recognition, and we'd certainly invite anybody in the audience to contact nVoq with any questions you might have. And again, thank the panelists for carving the time out of your busy days.